me start with Dr. Sandeep. If you can take us through exactly what, in your perspective, should be done at this moment, the way forward. Is it another lockdown? Is that the only solution?
Yes, the way the things are going, I think lockdown is the only rational way to control this pandemic. You can see the way cases has been increasing. Means we are crossed 2.5 lakhs per day, and that is a huge number of the cases. And as compared to these cases, our healthcare infrastructure is quite not adequate for these things. So I think the lockdown will be the same decision, and it is quite essential at this stage, at least for 3 weeks. Another thing is that meanwhile, this lockdown gives us to prepare infrastructure to do the rapid vaccination. So the two things will prevent us. One is the strict lockdown for 3 weeks, just like the way we did in last year. Western countries did 2 to 3 times lockdown. We can do second time lockdown in the same way. Second thing, in between, we should create the infrastructure, and third, we should increase the rate of vaccination. And at the same time, each and every citizen of India should behave very much responsibly. He should not go at the public places. It can be maybe the political rally, maybe the religious gathering.
Yeah, I mean, that's a no-brainer. Yeah. I think that's precisely what we've been advocating, not just us, the medical fraternity. Of course, people themselves know, are very well aware. It's enough publicized, enough lives that have been lost for people to understand that this is about time that they stop mingling or be part of congregations. But unfortunately, we are looking at political parties itself inviting huge campaigns and inviting people to come. The gullible, the innocent, or the ones who have really little knowledge about the virus are showing up at these campaigns or religious congregations and then going back home with the virus. So as much as that the media portals itself has, or the television channels or different kinds, word of mouth, word has been driven home. Despite that, we're looking at people coming out. And it's not like our netas are setting any precedents here. At a time like this, do you think a lockdown should be enforced to just keep a check? Because we're seeing a really scary, alarming rise in COVID cases. Dr. MP Sharma, you take that, please.
As for the current situation which is going on, like as Dr. Sab just said, with the numbers of COVID increasing day by day to leaps and bounds, lockdown, I feel, is the only answer. But we need to ensure that lockdown brings along with it very grave things as well. It brings out the mental trauma as well. It brings out the problems of migrants as well, the problems of employment. So it's a twin-edged sword. So if you bring in lockdown, you try to build up your infrastructure. You try to save the already crumpled medical institutions and the crumbling institutions of our healthcare industries. We are also facing with the burnouts of the doctors.
Yeah, and that's possibly a greater and a bigger problem than in compared to mental health issues. We understand that there have been reports of that, also the migrant crisis. But if we carry out a planned lockdown, then maybe it could be successful. But we also heard, the reason to why we're asking you this repeatedly, if a lockdown is a real solution here, is that the moment people are out there and a lockdown is lifted, you're looking at cases rise again. So how long can we endure a lockdown? Like you said, economically, it's very tough for a country like India. But what else is the solution? 2 to 3 weeks, you say, is the right amount of weeks. And after that, what? What if we lift the lockdown and again we see a surge?
So, there have been different countries where, they have done a graded lockdown. Germany as well was one of the countries which introduced that graded lockdown. They went into lockdown, then they opened up some bit, and then again went into lockdown whenever the cases surged. Even Japan did the same thing. So that is a very good example which India can follow itself, because in India, whenever the lockdown is open, you'll see that loads of people coming on roads. They're not, having those COVID appropriate behaviors as well. So lockdown will specifically help in reducing the number of COVID which is increasing right now.
No,